Our collaboration with UAG is focused on developing a diabetes program to improve the health of individuals who are at risk or have diabetes, but don't always have the care for their diabetes. And so we're building a relationship and a collaboration around how do we integrate community and clinical care for people who need diabetes care. The project we're doing is primarily, we finished a pilot project that was in one of the colonias Constitución in the Entecos here. So all of the work that we're doing together is focused on improving the health of individuals in Guadalajara in the colonias who are really at high risk for diabetes. So the collaboration includes lots of different levels. So currently we're focused on doctors at UAG and faculty members at ASU. We hope to build that collaboration where they're going to be moving from not only the faculty, but also the people who are running the Entecos. So whether it's nursing and students in medicine, as well as hiring promotores de salud from the community to participate in the project. So we've finished the pilot part of the project. So the update of the research is finishing the very beginning project, which says, can we do this? Can we identify people who have diabetes? Can we bring those people from the community into the Entecos or into the clinic? Can we improve the health of those people if they come to the clinic? And we've answered that question. The question is, can we do it? Yes. So that's the feasibility. Will people participate? The answer to that was yes. And can we improve their health? The answer to that is we think so. And so from this beginning project of can we do it? Yes. Should we do it? Yes. And does it work? We think so. We've now moved from the small pilot project into a much larger opportunity to think about how do we spread this across multiple colonias in Guadalajara. And most importantly, how do we do this in a way that addresses the needs of the community with the resources that UAG has, as well as advancing the science. The next step for this is a big step. So our next goal is we've developed a new project. And so we've submitted that project for funding. And so we'll have to wait, whether we get the funding on the first time or it takes a couple times to get funding. But our long-term goal for this project is to create systems that are looking at how to link people who need care with the care that's here so that we reduce what are called the comorbidities associated with diabetes. We reduce people dying from diabetes. We reduce people getting amputations when they have diabetes. We help people who have diabetes change their behaviors, but also connect them to the healthcare that we know is available, but is not currently being utilized. And if we do that, we think we can lower the risk of diabetes-related complications across lots of communities in Guadalajara. So the large team of the new project that we're working on, or we hope to work on, probably has about 15 total people working on it. But we think we're going to be going from 15 people working on it. The ability for us to expand that out, we hope to reach about 5,000 community members across Guadalajara. So we take the team that's the beginning team, we grow that team to build the relationships that we need, and we build those relationships both with the community members, but also with some of the doctors who are working in the Entecos. And our long-term goal is to build that network so that we can create a system that allows people who need diabetes care to get the care that they need, and that could be up to 5,000 people. Yeah, it's a great opportunity for students and faculty to participate from the university. One thing that we know is clear is the Entecos serve an important role in the community. And my understanding is that the Entecos represent a place for students as well as faculty to practice. So as students are graduating, they have an experience of working in an Enteco. Another opportunity is we're trying to see the mobile clinics that UAG owns, how we can use those mobile clinics to get out into the community. And I believe that those mobile clinics are also staffed either by the students or the ones that are doing their social service. So there's lots of opportunity for students to get involved. The faculty is a really important part of the Entecos. I think they're the faculty who are the supervising physicians as well as some of the nurses in the Entecos. So the best way to get involved is through the Entecos and this work that's really being done in the community to improve the health of the community. The message for the university community is research is about an opportunity to learn from each other. I think this is an exact opportunity that where I've learned a lot about what diabetes care is like in Mexico. I've also learned a lot about what we're dealing with up in the United States because a lot of our participants in research are coming from parts of Mexico. And so for me, it's a learning opportunity. The message here is the more questions that we ask with the more questions we ask with people, I think the better our questions get. I think those are more likely to turn into solutions that not only help the communities here in Guadalajara, but also are going to help the communities that we work with in the United States.